So at the end of the last in-service, I touched briefly on footwear. And for those of you that don't know, I have a non-union in my right foot after the Lapiplasty that I had to fuse the first metatarsal medial cuneiform. And when I left the last appointment with the surgeon, he recommended a series of shoes, including the Hoka Bondi, a New Balance, highly foamed, MBT, G-Defy, and I went ahead and got some of those shoes, and I hated all of them. And I actually found that I had more pain with all of them. So I started researching where that shoe trend started looking at the research, went to see Clyde, and we put together a presentation just to reveal what I found and the outcome ultimately for me, which is not what I expected, but we'll get to that. So What the Shoe, Navigating Choices in Footwear. That is my collection of shoes in Clyde's office. So I started with where did the rocker and the oversized soles trend start? And the first modern rocker, is there a way, sorry, Ken, that I can lose that window? There we go. Okay. The first modern rocker soled shoe was called the MBT, and it's based on Maasai Barefoot technology developed by a Swiss engineer in the 90s to simulate the feeling of walking barefoot on soft earth. And yeah, I'm not so sure about that. But the shoes feature a distinct curved or rocker sole to simulate the biomechanics of walking barefoot, and they were intended to engage core muscles and improve posture. We can talk about that. And that company's success led to other shoe companies developing their own versions of the rocker sole. And the technology is now common in many footwear lines. There are many, many choices, and it's gotten very complex, in my opinion, and really hard to navigate. Some of those rockers can have just a toe rocker, or they can have a heel and a toe rocker. So the theory behind the MBT shoes is that they transform flat, hard surfaces into uneven surfaces. And so the shoes may act as an unstable training device, thought to specifically activate and strengthen the smaller extrinsic foot muscles while walking or running. And the theory was that by activating these muscles, it was proposed that joint loadings could be reduced, and an ankle joint with stronger foot extrinsic muscles could more effectively control ankle joint movement to achieve stability. Does anyone have any thoughts on that?
I guess
No?
it's a little bit odd that because our foot with all the joints are also designed to like absorb shock by landing on the heel and pushing off the toe. So to put a object on the bottom of the foot to do that instead is arguably maybe not that good of an idea.
Yeah, good points. And something that I thought about was the foot intrinsics. Like if you're putting a thick piece of foam and you've got the extrinsic muscles working, are you getting, I don't know, are you getting good foot intrinsic muscle activation? That was a question that I had.
To me, it makes no sense at all. That's
Thank you. And I went onto the MBT website just to have a look at selecting. There's like 100 different kinds. And they ask questions like, are you walking? Are you running? Are you standing? Are you looking for support and relief, stability and balance, or flow? Flow, that sounded pretty gimmicky to me. All day comfort, biomechanical support, athletics, everyday and errand walking, fitness and intentional walking, or outdoor and trail walking. Like so many choices. And I don't know how they have all these different shoes to meet all of that and how you're supposed to choose. And then I would just say choosing is complex, and that's without a biomechanical evaluation, which, as we're going to reveal, is critical in deciding on what to wear. Does anyone in the room wear Hokas? Is that a no across the board?
I have a pair of Hokas. I don't wear them very often, actually. I don't like them that much.
And do you know why don't you like them?
They don't feel that stable. Like I don't have much contact with the floor.
Yeah.
And
Yeah.
Akiko said she has a pair too.
Okay. That is a key point, that they're unstable. The Hoka trend, I didn't know this, was created by two runners in the French Alps in 2009, and the shoe was designed for faster downhill running. They were inspired by the feeling of flying freely down mountains and hills, and they wanted to create a shoe that made movement downhill feel effortless. So they designed a shoe with an oversized, cushioned midsole, a wider base, and a curved rocker geometry to complement the natural gait cycle. But running downhill, yeah, that's a different that's a different activity than just normal everyday wear. And those shoes, I didn't know this also, were first catered to ultra marathon runners who needed maximum cushion and stability for ultra long runs. And since then, the brand has expanded to focus on comfort for everyday wear and active lifestyles. And I would say enter the celebrity and influencer endorsement here, and many myths that we'll also get to. I hated the Hokas. Those were my least favorite after the surgery.
I had the Topo, T-O-P-O. I was wrong.
Right.
But they're kind of similar, but
Yeah.
they have a square toe. So and they're not exaggerated big. They're like, they're not the really thick ones.
Yeah, yeah.
Mm-hmm.
And then at the other extreme are the Barefoot minimalist shoes. Also became popular around 2009 among runners. Very little cushioning and heel drop. And they're theorized to reduce injuries by promoting a more natural forefoot strike. And the theory with those is that they help your foot intrinsics get stronger by requiring more muscle activation than traditional shoes with the arch support, and forces those muscles to work harder. And the popularity with those type vary. There are some diehards about barefoot shoes. And also that one's connected to the barefoot trend, which is related to being closer to the earth and grounding versus being separated by layers of unnatural rubber and foam. And I would add that there's a wide toe box. I didn't have that in there on the barefoot shoes that allow for toe space, which has been really key for me also. I just looked up some of the research on the minimalist. I'll try to go through this quickly so we can chat. With the minimalist shoes, the influence of the foot strike on the load rates. If you were a forefoot striker, the load rates are lower. If you're a rear foot striker, it's similar to a conventional shoe, which had no difference in loading between forefoot and rear foot striking. And so if you're a forefoot striker in a minimalist shoe, there might be a reduced risk of overuse injuries. They also looked at kinetic changes during a 6-week minimal footwear and gait retraining intervention. And in that study, they found that the loading rate was higher in the minimalist shoes, especially in the beginning, but can decrease over time with gait retraining. So if you're with a PT that can help you learn how to walk on them properly, the loading rate goes down. So with the minimalism, the research is super mixed. Some studies suggest that adopting a forefoot strike pattern does not decrease injury risk. It doesn't improve running economy, and it doesn't reduce the impact peak or loading rate of the vertical ground reaction force. So there's a lot of mixed studies on that. So not super clear. And then with the Hokas, I found there's a couple of women in Oregon. One of them used to be a PT. They've done a lot of studies on the Hokas to try to look at all the myths or the theories that were out there. So they used a flat force platform analysis. It's a test that involves a runner stepping on a platform to measure the force. And we all know when we step, the body has to mitigate the shock through the bones and cartilage, or by changing its geometry by compensating. And the belief was that footwear should help cushion the foot ground collision force. Surprisingly, it was found that a softer midsole offered no benefit over a hard midsole. And the average loading rate and impact peak were actually significantly higher in the Hoka shoe compared to the traditional shoe. And that was even after 6 weeks. So that was critical for me because the whole point with the surgeon was that he wanted to cushion my midfoot. And he actually gave me a pair of shoes that might have been worse than a regular shoe. So one of the conclusions with that, it may be that runners are relying too heavily on the maximal soles and are not using their internal structures to dampen the forces adequately. So we get lazy. Are there any thoughts on that?
Kristen, my experience is the people are trying to rely on the shoe to do what the foot does naturally. And as speed increases, people become more of a forefoot striker than a rear foot striker, so that, and their center of gravity doesn't really elevate as much. The slower you go, the more, I call it plodding, you do. You go up and down, and the foot has to absorb a lot more force because your center of gravity is generally rising up and down higher than a person who's running quicker. Their center of gravity is very dampened in terms of how much lifting goes on, and the limbs go through the range of motion. So I don't know what the speed is, but I think it's somewhere, you know, in the terms of running a mile at a quick pace, that those people that run it over 5 minutes are by and large probably more forefoot striking than rear foot. And those that get closer to 8, 9, 10-minute pace, they're all heel strikers or landing on a flat foot that is just absorbing totally different. And then the shoe, which should allow the foot to sort of absorb, because the foot is built very well. The heel pad is built very well to absorb shock. What it doesn't like is shear. And the foot, if it's not stable in the shoe, it slides side to side and you get a lot of shear and you get a lot of compensatory movements. That's not even looking at the whole chain. So the pelvis, the leg length, and other things that certainly play into it. Those are my thoughts.
Very helpful because speed is definitely a factor. I'm gonna try and go through these quickly. So further research with the Hokas, I did find a study because there's been a lot of talk, and I've heard it spoken of a lot, that it helps with plantar fasciitis. So yes, I did find some studies that they found them beneficial early stage plantar fasciitis for relieving the pain, predominantly in women over 50 years of age. An interesting thing for me, this study was interesting. The rocker soled shoes can change the kinematics and muscle contractions of the lower extremity during various functional movements. So what they saw was you'd get more external rotation at the ankle, probably because they're unstable. So people were trying to widen their base of support. But also there was less hip external rotation and extension. And for me particularly, not good for my biomechanics. Some of you might remember the picture that I showed. I have a tendency to toe in. My hips are internally rotated. So it would just exacerbate that in my particular biomechanics. And I was like, these are not the shoes for me. So this is another speed thing, Clyde, that you were just talking about. So running in highly cushioned shoes increases leg stiffness and amplifies the impact, especially at higher speeds. So more cushion does not protect against impact-related injuries and may increase it. And there's less risk of that at slower speeds. Does that make sense based on what you just said?
Well, I think that, yeah, the slower you go, you're on an unstable surface, the harder your foot and lower leg muscles have to work to stabilize. The faster you go with a really thick shoe, to me, would just be, again, landing on an unstable surface, and the foot's going to be working a whole lot harder than it should.
Right. And the leg stiffens. So there's been research that shows that if you go from a stable to an unstable surface, you get increase in the leg stiffness to mitigate that. So
I wonder what they define as stiffness, as muscles working harder.
That's
to
a good question.
stabilize?
I'd have to go back and look,
Yeah.
but I'll find out. Yeah. Again, the maximal running shoes increased impact force. That was another study. And one last one, how the new running shoe technologies influence biomechanics and injury outcomes in recreational runners. The lowest load, they looked at a whole bunch of different kinds of shoes, like the Hoka Bondis, Max, Rockers, just a neutral, like a normal conventional shoe. And the lowest load on the Achilles was with the Max running shoes, the Max cushion. And also the Max cushion running shoes with rocker technology can increase knee loads, the maximum extension moment for the quads, PT, patella, and the patellofemoral joint compared to all other sole technology. So you can get maybe some help for the Achilles, but it can potentially increase knee issues. So just to summarize, what might Hokas or rockers be good for? And Clyde, you can step in here and argue this. But this is kind of what I summarized based on the research that I saw. So plantar fasciitis in the early stages, if you've got OA of the first MTP joint or the ankle or hallux rigidus, the rocker is going to reduce the stress through that joint. Achilles tendonitis, possibly. The increased drop decreases the strain on the Achilles. I saw mention for a diabetic foot because it allows for diffuse pressure over the forefoot, and a rigid foot, which Clyde and I talked about, because you'll just get immediate relief on impact. But Clyde, do you have any thoughts on any of that?
Well, the reducing of the toe extension, that's probably on a toe that's already broken down from wearing. And so the shoe itself is not the extension that's the problem. It's the medial push of the hallux from the shape of the toe box in many shoes. So by the time they get to wearing a Hoka, I would guess that many people already have the problem. And so reducing the toe extension might be more comfortable, but it doesn't change necessarily if the shape of the shoe is wrong, the mechanics that causes the toe to get stiff anyhow.
Yeah. Some of the things to consider with the Hokas or the rockers, they're less stable, absolutely. That's been mentioned here. And those, I have a lot of elderly clients that wear them, but they're unstable. If you have reduced proprioception, it just makes you really wobbly. It can affect things higher up the chain. For example, there was a study that showed that wearing those increases the degree of hip and knee flexion. So with anyone, you need to look at the individual biomechanics to understand what's going on through the whole chain. May increase the risk for running related lower extremity injuries, especially at higher speeds. May increase the risk for knee injuries. And just the question, are we training our foot intrinsics with those shoes? And just a note, despite significant advances, I don't know if I would call them advances, I would call them changes in shoe technology and increased complexity over the past 50 years, the rate of sustaining a running related injury has remained relatively stable. So they really haven't helped. And maybe Clyde, you can touch on how things were many years ago, because we touched on that briefly.
I'll take that as a compliment.
Absolutely. Like things were simple at one time, but you shared something with me earlier today that I think would be helpful around that.
Interesting when you comment on, if the foot is unstable, then you get compensating less range of motion work in the knee and hip. So one of the automatic sort of reflex reactions is if you're standing on an unstable surface, what do? You try and lower your center of gravity relative to the base. So the compensation of the knee and hip not flexing as much as they would in a very normal sort of, or in a stable foot situation makes total sense, that they are on an unstable surface. And so you're compensating, your center of gravity to stay stable by flexing all of the structures above and lowering it. It's a reflex action that most people probably wouldn't even be aware of that they're doing until they start to get some soreness or irritation from it.
Yeah.
I think what you're referring to is when I got interested in shoes and feet very, very soon in my career because I was given a book by he was my family doctor actually, who passed away, and his wife gave me his books. And one of them was called The Postural Complex. And it was written by an orthopedic surgeon in 1952, I think it was. And it's still to this day the best mechanically descriptive sort of situation of how the foot relates to the knee, to the hip, and so forth. But back then, when you picked a shoe, you had straight last and curved last shoes. And people who had a rigid foot were advised to use a curved last system because a rigid foot does not absorb shock as well as a mobile foot. And a mobile foot person was advised to take a straight last shoe. And then the shoe companies started to make what they called a neutral last because at the same time, orthotics became very popular. And the orthotics were trying to compensate for what the shoe couldn't do for the person that was wearing the shoe. And so they started making what they called a neutral last that didn't really fit the rigid foot or the mobile foot because they said you're going to have orthotics anyhow, and that will compensate for what we're doing. And then the shoes got to be so cumbersome, but even in the Hoka, I don't know if you guys can see these. Can you see it?
I think
Maybe
you'd have
this,
to share your
yeah, I
screen.
don't know.
I don't know.
Maybe can you take the slide away for a minute?
I don't know how to do that. Hang on.
I can't get it big enough. Well, you can see it there. So that's a pretty straight lasted full sole shoe. There's no cutout. And then if you look at this shoe, the difference in it, it's a very curved last, and they've cut this out on the bottom to take away weight. But in doing that, the shoe then becomes an unstable surface. So most of the time the foot will slide off of that. When you look at the shoe on the inside here, you can see the wrinkle. And whenever you see that in a shoe, you know they're falling off the shoe, and probably the shape of the shoe is wrong for the individual. These just happen to be my biking shoes that when my foot is on the pedal, I don't have to worry about heel strike. And when I get off the shoe, and I didn't wear them very much, but they break down very quickly. I don't wear them for cycling anymore either, but so that would be a straight last versus a curved last sort of shoe, and the difference in the foot and how the mechanics work are very different. I think most people should have a very straight lasted shoe if you want to feel like you're walking on the ground. And Kristen, I think you stated that you feel more comfortable wearing Birkenstocks, and you wear them around the house. And a Birkenstock is a fairly straight lasted shoe with a little bit of a molded sole and a wide toe box and a deep heel cup that keeps the foot very stable on solid ground. It's not very good on uneven ground because you slide on and off it. But if you can get a boot or anything that fits similar, that has rigid sidewalls that can stabilize you, then that's what you look for.
Mhm.
Clyde, if we only have a wrinkle, because I've got that wrinkle on this shoe and I
Yeah.
actually run really fast in these, but if I only have it on one side, then it just means I'm striking or landing differently, like if my foot's fallen off.
Well, it probably means that you have a slight leg length difference that you've compensated for with some pelvic rotation and that on the opposite side.
Yes, which we do know
And
that.
then that whole series then starts to bring up a compensation of in runners iliotibial band syndrome, a lot of syndromes that are messaged and pain in areas that aren't even related, but really the way the foot reacts on the ground starts to dictate how the whole system reacts above.
Thanks.
I have a question. So for someone who's already used to back support shoes like Focus, how would you go about weaning them off of that and transitioning to like a
I'm sorry, what was the question?
for someone who's already used to like a back support shoe, like the Hocus, how would you go about weaning them off that into a less supportive shoe?
Well, I'm not sure. I would look at the shoe and see what's happening, like Kim showed. If the shoe is going to be breaking down on one side or the other, you can look for certain things. You can look for, if I show you in, you might not be able to see it, but there's a little hole in the back of, oh, it's the left side. So I'm very short on my left leg, and these have a raise in them to compensate some, but my heel still rocks. And so see that hole in the back of the shoe? That's from my heel calcaneus rocking back and forth inside of the shoe. And it's not from the up and down motion, it's from side to side rocking, consequently then the whole foot like this. So everything is constantly shifting. And so you could look at the shoe and it might be a perfect shoe for somebody. It's wide toe box if it fits the foot and you can't see any sort of other issues from it, then that's fine. There's no one shoe that fits everybody. I think you look for the length of the shoe, the toe box of the shoe, and you look for the shape of the shoe, whether it's a straight last or a curved last. And even in the minimalist shoes, the barefoot running shoes, they're not all the same. And as Kristen and I sort of looked at the heel cup in many of them is not deep, it's flat. And so what you hope to get in the minimalist shoe, oh, my phone is answering me. What you hope to get is a very stable rear foot and forefoot together, but that's not always the case.
Mm. So maybe I'll show you some of the thing. I'll bring up some of the things that we did, Clyde, to kind of
Sure.
illuminate what we explored. I'm going to go back to screen sharing. Okay. So I went to see Clyde at his clinic. Why do my Hokas hurt was the question. So what we found, or what Clyde found, so on the side of my non-union, I have an anterior rotation, so with a longer leg on that side, which is going to drive different forces through that foot. I have a very narrow heel relative to my forefoot. That's been a lifelong thing that I've never addressed. So I slide around in the shoe. And with my gait and the Hoka or the New Balance, the cushy foam and the sloppy heel drives more inversion and pronation, which was causing increased stress and pain through the non-union area and all of the joints around the navicular. So it made sense once we started to look at it. And then the curved lasts of the Hoka and the New Balance shoes that I had, Clyde showed me how it drives big toe adduction, which he just touched on earlier. And it also, for me, drives a toe and gait. So it's actually creating the biomechanics that gave me the bunion in the first place. So all of those things together, I should not be in that shoe. And then we touched on the heel cup depth, important with barefoot shoes. I do have an orthotic that I'm going to show you. We had some fun building up. He showed me a DIY insole or orthotic thing. And then taping to stabilize my rear foot, abduct my big toe, and splay the forefoot, which I hope. I have a video. That's just another picture of different lasts. The Birkenstocks are on the right. The barefoot shoe that I have is the second one from the right. And then some taping that he did with me and showed me how to do. So I have a video. I'm hoping you'll be able to hear. I don't know. I've never done this before, so.
So you want the first ray
Can you hear that?
flexed and adducted as much as possible. Yours are going to be limited somewhat, so that the toe has as much freedom as possible. When it's dorsiflexed and adducted, you release or remove some of the dorsiflexion in the big toe. So you have to roll off the inside of the foot. You get these big calluses where it pinches. So we do this. And the tape literally is laid on, not pulled tightly at all. I just place the first ray where I want it and then lay the tape. One. Two. And if you look at the toe spacing right now, from the bottom, look what it does. It abducts the toe away from that second. And this is designed to stabilize the mid-tarsal joint. And it locks the heel in. And
I should have said subtalar joint.
And when you said, I feel best when I'm standing on a soft grassy surface, is perfect. Because the grass, the dirt comes up and meets the foot and holds it pretty neutral in the midfoot and allows the toes to spread. And when I took a course from a podiatrist in upstate New York, and I cannot remember his name, 40 some years ago. That's exactly what he said your foot should feel like in shoes. But it's difficult. The last piece of tape, when you put it on, you lay it on the foot. You don't try and pull it tight, and you splay the forefoot. Because when you stand up, your natural body weight is going to tighten up the whole structure. And if you get it too tight here, you'll get a cramp in your foot. So it's kind of wrinkly here, but now when you stand up, so let's get you stand. You'll feel it tighten up.
Okay.
Okay.
Could everyone hear that?
Yes, we could hear it.
Okay.
It was good.
Okay. So yeah, my experience with that taping cradled my calcaneus and stabilized my rear foot. And it aligns the ankle knee hip chain, reduces heel shear, and keeps the heel pad under the calcaneus. And in barefoot shoes, this supports proprioceptive control and prevents heel slippage. And we touched on the Birks. They do have deeper heel cups, so I do like wearing those. The left is the Birkenstock. The right is an orthotic. Clyde, I'm not sure if I showed you those. They're called Stride Soles. It's a German company, but they have a nice, they hug the heel. So
I saw the pictures of them, yes.
yeah. Clyde, do you want to go over this? This was your slide, the fit evaluation checklist for shoes.
Well, I just, again, I go into put all this information that comes off the top of my head, and sometimes it falls nice and other times it falls to the side. So I asked ChatGPT to go through an evaluation checklist and from information that I talked to, and so this is what it came up with. A heel slip test. The heel should stay seated, and in many orthotics, when you get the person to just stand on the orthotic, it'll fail in 2 or 3 of these. And many times the orthotic itself is too wide for the shoe, so that even the shape of the shoe can't be used to help stabilize it within the orthotic, because the orthotic is much wider than the shoe, and that creates a problem in itself, that in the midfoot section particularly, because it creates a cantilever effect that's hanging over the edge of the shoe. So when you transfer your weight through midfoot, you just fall right off the shoe. The contour check, you look, if the heel, I didn't show this to you, Kristen, is if you're standing on your orthotics and they fit well, you should be able to manually extend the big toe into its maximal extension. If you're putting too much weight on it and on the first ray and the orthotic isn't fitting properly, you won't be able to get the big toe off the ground.
Hmm.
And the rear foot, the heel pad centering, the fat pad is designed beautifully to take compression and force. Again, if the heel contour isn't properly and you slide back and forth on the shoe, you're creating shear. It doesn't like shear, but impact it's designed beautifully for. And then that heel rocking back and forth, I'm convinced that it's more impactful on creating Achilles strains than going up and down, because it creates torsion on the Achilles when it drops down, and then you push off at the same time. You get a twist or a torsion, and any fiber or wrapped cable system where you have a braided system, it doesn't like torsion. It unwraps the braids. And that's why whenever I get somebody who has an Achilles tendinopathy, if you use that taping technique on them, you'll get immediate relief.
Mm.
And I've had they'll come back every week for several weeks and want to get it changed, because it just gives complete stabilization of the rear foot and stops the torsion through the Achilles.
Amazing. We touched briefly on lacing too. Clyde showed me how to change the lacing of my shoes using those two little holes up near the ankle. So there's that, and then it's just a way to better cinch the shoe around my ankle to stabilize my rear foot.
And you don't have to tighten up the midsole then so much.
Yeah, and it was super snug after that. And I just wanted to say, when Clyde taped my feet and I walked, it was an interesting experience, because I've never felt like that in my body. Like, I've never felt that straight. There was space in my toes, like everything felt aligned, and there was I don't even know how to articulate it, but I almost cried. So that was,
And I had a patient that literally, she did produce tears about a month ago, that when she stood, it changed her whole feeling, not only about her feet and it changed how she just approached life. It's really quite remarkable when people all of a sudden, the proprioceptive input, and we haven't even talked about how the two sesamoid bones are so important for proprioceptive input of the whole limb, the whole body and its position in space. And when they post an orthotic and put a wedge under the front, it shifts it all off kilter.
And then Clyde made this chart, which, maybe we can send out to people, just illuminating all of the different features. Obviously the Hoka Bondi, proprioception diminished, the barefoot with the rear foot control, it's optimal. Yeah, Clyde, you talked on, like, we were trying to figure out, like, where would you wear a Hoka? Where would you wear a barefoot? Any comments on that, Clyde?
It goes back to the fit of the shoe.
Yeah.
And yes, there will be some people I've seen people who've had really the kind of foot that you presented with before your surgery. And it's rigid. They don't have much mobility. And sometimes the Hoka does really well for them in their lifestyle. Now, would they run with it? I don't know that they'd run with it. Early on, I believe that if the closer you can get to a neutral foot with some, protection of the foot from the bumps and little rocks and things on the ground, I think better off the person's going to be. Children learn to run in their bare feet. I've seen people run marathons in barefoot in Vancouver. The foot is a very adaptable structure, and to the point where people who don't have limbs can do their shirt buttons up. They can learn to do things, and we encase it in a box and stop using it, and most of its potential is gone. And so I think it goes back to fit. You've got to figure out a fit. I don't know. I don't really even pay any attention to shoes anymore. I look at the fit. And if it's an Adidas, fine. If it's any off-the-shelf Skechers, fine. As long as it fits and allows the foot to work biomechanically. I think the biggest thing I end up doing with mini shoes is I build the insoles for them. I cost them 50 cents for the felt. And if the shoe is wide enough, long enough, and the rear foot stability, it's really easy to build up the midsole.
Yeah, I was just gonna, I thought I had a picture of those, but maybe not. Yeah, I think that's basically everything. The conclusion to my story currently is that I wear Birkenstocks around the house, and I'm not walking a lot right now because he did ask me to not do a lot of walking until that foot heals up. But I do wear the barefoot shoe with the orthotic with the deep heel cup, and I'm working with tape. I did react to the tape, so I've got to figure out a way to tape my feet. Milk of magnesia apparently helps, so I'm going to try that. And yeah, I'm just gonna. That's where my feet feel best right now, in the barefoot. So
Thank you, Kristen.
Oh,
Thank
yeah.
you, Clyde. Does
There-
anyone
any
have
questions?
any
Yeah.
questions? Or does anyone else want to go get their footwear and look at it?
Yeah, I get people to bring in their oldest, most beat up pair of shoes because it tells a story. And they'll come, I mean, they come in complaining about low back pain or something else. I still want to look at how they're working from the ground up. And that taping technique is probably the most useful taping technique a person can learn.
And it's called the Lodi?
It's based on a Lodi taping. He was a podiatrist who developed it. I call it a modified Lodi because it is a little bit different for sure.
Okay.
But it really is to stabilize the rear foot. And it took me a long time, Kim, to sort of think, why does it work so well? And I didn't really realize that it really is the pressure of the forefoot splaying tightens up the tape that's under the arch, which most people think that it's for arch support. And when that tightens up, it cinches up around the rear foot of the heel and stops the heel from moving and being unstable. And I think that's where the strength in it lies, is locking up the rear foot, because you can have an orthotic, and many people do, and the rear foot isn't stable and they still don't get any relief from the orthotic.
Yes. Yes. I was fortunate to have Clyde tape my feet that way too, and it did feel good.
Mhm.
A lot of dancers certainly learn how to do it themselves because they don't have they can't put a shoe on. But they learn how to do it. And it's for many people, it's a very easy thing to do. You measure the tape length and you just tear all three pieces off that before you start. And when putting it on, if you hyperextend your big toe as far as you can, it will plantar flex the first ray into the position that you would lay the tape on under. You never put it under the ball of the feet because you'll create blisters under the heads of the metatarsals. I mean, you'll get sheer blisters, and that then turns people off of the technique. So you go just behind the metatarsal heads.
Fascinating. Does anyone have any last questions for Kristen or Clyde? Okay, thank you everyone for attending. So just a reminder to please RSVP to